Now we will scan the epigastric area to rule out cause of swelling and pain by placing a convex probe in transverse position. Here we see a large cyst with multiple septations. The fluid present in the cyst containing debris or having a granular structure. This cyst resembles like a chocolate cyst or hemorrhagic cyst which contain blood. Now when we think that it is hemorrhagic cyst, then we need to find out the origin of this cyst. When we scanning this cyst, we feel strong pulsation on the probe, which indicates that this cyst is arising from blood vessel. Now we will try to find out the origin of this cyst. Now when we focus here, this is abdominal aorta, which lies posterior to this cyst. Now we will scan the aorta. If we focus here, we see that the aorta is communicating with the cyst through a tract. So there is defect in the anterior wall of aorta and it is communicating with the cyst. The hemorrhagic fluid is collecting in the cyst. Now we will measure the volume of this cyst. The approximate volume of this cyst is 2006 milliliter. Now how we will write report.